So this is a video I'm making for you, Joe Rogan. You did train in Easton's at Boulder and in Colorado, which is where I train and who I got my brown belt under. But I do respect you, and we do have some mutual friends. However, as a chiropractor myself, and to hear you say that chiropractic is bullshit is total bullshit. Especially coming from you, where you like to bring up some science and you talk about confirmation bias. Well, what you did was clearly confirmation bias. You said chiropractic is bullshit, and the people you had on your panel agreed with you. Well, why don't you bring someone on that can talk about the science of chiropractic, right? Let's discuss what this means. I've testified in court as an expert on the science of it. And in fact, I've treated a lot of your friends and some of your teammates, as well as a lot of my teammates, where chiropractic has not just made them feel better, but improved their quality of life and got them back on the mat so they can continue to do jujitsu, where the other healthcare arenas told them they have to quit and they should quit and there was nothing else to be done. Now, I do agree with you, Joe, that the care that it sounds like you got from a chiropractor was bullshit. But that does not mean you can say that a scientific and research-based treatment that has been proven in the science to be bullshit with nothing to back it up or validate it. Now, you had a bad personal experience. And I can tell you as a chiropractor, I hear about that a lot in my profession. But I also see it a lot throughout healthcare in general. Let's take a look at the opioid epidemic, okay? I'm going to give you this right here, looking at the Journal of American Board of Family Medicine. They looked at over 26,000 patients. Now, out of the patients, the majority of them, 78% in fact, went to their primary care physician with the diagnosis of either low back pain or sprain strain. And what did they get from their primary care physician for treatment? They got an opioid. Now, I'm not here to throw medicine under the bus because I refer to medical doctors and I get a lot of referrals for medical doctors, and I myself have had medical procedures, okay? But to say that it's all bullshit is completely unfair. Now, let's talk about this opioid epidemic. The diagnosis in this study for low back pain or sprain strain. One, sprain strains are shown in the literature to get better on their own. So why would a provider give a patient a highly addictive opioid for a condition that would have gotten better on its own? The other thing is, let's talk about low back pain. Even sprain strain we can throw in there. If we look at the science in the literature for what has been shown to be an effective course of treatment, it's chiropractic. It has one of the highest satisfaction rates, and we can discuss why the science validates why the patients are getting better and physiologically why that makes sense. Now, can we say that medicine is bullshit because it caused the opioid epidemic? No, but what we can say is that the majority of those providers that gave OxyContin to these patients were treating, in my opinion, poorly. And most likely, the chiropractor that you went to for the little bit that I know, sounds like he didn't treat you appropriately either. It sounds like you had radiculopathy. He took no images. He didn't look at the sagittal alignment of your curve, or if you had instability or any other problems, and he didn't refer you out for a MRI after a short-term course of conservative treatment. Now let me ask you this. Let's say that chiropractor was treating you. Let's say you came to my office, Joe, and I was treating you. And I said, hey, Joe, you have some radiculopathy. This could be coming from a number of things. It could be from intervertebral foraminal stenosis caused by maybe a bone spur. Maybe it could be from a disc herniation. Maybe it could be from, pick a number of different reasons. Now let's say I x-rayed you and I saw that there were some pathologies that were identifiable on the x-ray, and we tried to improve that. Now let's say even with that you weren't getting better. And then after a short period of time, I referred you for an MRI. And we found something that wasn't going to get better with conservative care. Maybe you had a completely broken off piece of disc material floating in the canal or in the intervertebral foramen, and now I referred you to a neurosurgeon. And then that neurosurgeon did surgery and got better. Would you still think that chiropractic was bullshit? Or would you say, hey, my doc, Dr. Katz, really helped me? The treatment didn't help it, but man, he got me onto the right track. Because what you had was a problem that wasn't responding, and that doctor, it sounds like, I don't know all the details, didn't take the time to help really evaluate you. But to say that chiropractic is bullshit because you got someone who it sounds like didn't really follow up with you and didn't really do the appropriate courses of treatment or imaging, I personally have a problem with. Let's talk, get me on your show. Let's bring, I can't talk about it from a HIPAA perspective, but let's bring on some of the UFC fighters that I got back into the octagon with chiropractic care. Let's talk about the research. Let's talk about some of the studies that I've published and I have being written right up for publication to show the amazing benefits of chiropractic care. Same thing is true, Joe. There's a lot of people out there doing podcasts. The one guy you were talking about with dinosaurs saying they didn't exist. Can I say everyone who does a podcast is full of shit? No. We could take it by a case-by-case basis of who's doing podcasts and what information they're putting out there. In the same way that I can talk about, I've been to really good dentists, I've been to wonderful dental hygienists, some were crap, some were fantastic. Now, it's a good thing I didn't stop when I had a crappy hygienist, or I wouldn't be getting my teeth cleaned every 3 months with the wonderful hygienist I have now. Or what about the primary cares? You know how many horrible primary cares I've been to, or horrible surgeons I've seen that my patients have seen that have gotten full fusions and their quality of life was terrible compared to other surgeons that are a little more conservative, looking at the research a little more closely and doing things differently? You can't make a blanket statement, especially when it comes to healthcare, but you can certainly talk about your individual experience at an individual office. Again, I think podcasts are great. Obviously, I listen to your podcast. Not everyone who does a podcast is full of shit, but there's some that are more full of shit than others. Usually you're not, but I'm going to call you out and say what you said was total shit. And if you really want to discuss it, bring me on, man. Bring me on, and I'll bring on some of the UFC fighters that I helped, which I know you know and I think you've trained with. So I hope this is beneficial. I hope this makes some sense. But let's not make these giant blanket statements about healthcare, especially if the research that's out there clearly validates treatment and the patient outcomes and patient satisfaction rates are extremely high for chiropractic. Again, I'm sorry you had a bad experience. Man, next time you're in Boulder, come to my office and I'll show you how it's really done. Thanks, man. Hope to talk to you soon.